this is Anna Brogan, and I just wanted to go over some brief points about my patient before we do this physical examination. She is healthy. She's not on any medications. She is Israeli, but she doesn't practice any other religious customs or anything that would impede our physical examination. She is aware of what we're going to be doing, and we have all of our equipment laid out, and so she is ready to rock and roll. She today has eaten oatmeal for lunch, and she had a sandwich and chips she had oatmeal for breakfast and a sandwich and chips for lunch that we ate here at the school, and she hasn't eaten any more than that. She's drank probably 3 bottles of water, and that's it. So she hasn't had much for a 24-hour recall. Her last meal was dinner yesterday, and she ate a light salad. Skin, hair, and nails are great. Her hair is very long. Her nails are great. They're not brittle and they're not thin, and her skin is awesome. I'm very envious because it's almost perfect. So that is a brief history and just some little points that I thought might be important, and we're gonna rock and roll. Hello, my name is Anna Brogan, and this is my patient Leah Styrwall, and we are doing our physical assessment. Here are all of our supplies. We have our ophthalmoscope and our otoscope, our small Snellen chart. We have our long-range Snellen chart right here. We have a tongue blade. We're going to use this to do sensory detections on the hand because we don't have a pen or needle. An alcohol pad, our cotton swabs, our pen light, flashlight. These are going to be for our reflexes, and we don't have a tuning fork, so we're just going to make do. So let's get started. Okay. First of all, I'm going to assess the patient's head and neck. We're going to palpate the skin, hair, and scalp, thyroid, trachea, cervical nodes, and we're going to check for TMJ. We're going to observe her range of motion and inspect facial symmetry. I know Leah, and her face is symmetrical. Everybody has asymmetry, but she has no defined asymmetry. Can you put your neck to the left and right and up and down for me? Thank you. And can you do a circle? And then the reverse. Thank you. She has great range of motion. I'm going to palpate. I think this is how I'm supposed to do it. Okay. Can you see me? Okay. Okay, that sounds good. Her notes seem impeccable. Okay, can you open and close your jaw for me? I'm going to check for TMJ. She has no obvious clickings or problems with her jaw. Okay, now I'm going to palpate her head. She has clean hair, so that's good. Okay, everything seems fine. Now on to her eyes. We're going to do the Snellen chart last because she has to get up for that. I'm going to check her pupillary light reflex right now. Okay. Good. Okay. This patient does reflect perla. Her eyes are great and her reflexes are prompt. Okay. Oh, I need to do her corneal light reflex. My light will stay on. Okay. I'm going to do that. The center. Okay. Now, her eyes have great range of motion, and I'm going to use the ophthalmoscope now. Okay. Can you scoot to the side of the bed for me, please? Okay. We're going to use the ophthalmoscope. Okay. Great. I don't break it. Okay. Now, let's see. I think that's it. I'm going to check her range of motion of her eyes. Okay. So we like to come back to the center when we do this. So we're going to start Looking good so far. Okay. Great. Okay, now can you follow my finger in? Great. Okay. Now we're going to check the patient's ears. I'm going to use the otoscope and inspect the external and internal ear. Then we're going to do their whisper, Weber, and Rhine tests. Okay. Feel everything. Okay, in an adult patient, we like to pull up and out on their ear. If she was a pediatric patient, we would pull down. And if I can get this thing, I have put a clean cover on this table down. She's not even waxy. So that's a plus. Okay. Let's see. Her internal and external ear look fine. We're taught in class that if she had an ear deformity as a pediatric patient, it could indicate something wrong with her kidneys. But she doesn't, so we're good to go. I'm going to do the whisper test on her now, which I think she's going to be okay, but you tell me when you hear me. I hear you. Okay? I hear you. Great. Okay. Now we're going to do the Weber and Rhine test. We don't have a tuning fork, so we had to make do. But it'll work. Okay. Because I don't have a tuning fork, I'm just going to stand back here and do my best. For the Weber test, the patient will equally hear the sound in both ears, and sound does not lateralize, so we will see if she does that. Let me know when you hear this. Oh, that's perfect. Great. For the Rhine test, normal sound is heard twice as long by air conduction as by bone conduction. The person is supposed to hear equally on both sides. So. Great, okay. Okay. Now, on to the nose and sinuses. It's allergy season, so it'll be common for her to have problems, but right now she doesn't seem to. We're going to check the patency bilaterally and then view the nasal cavity, turbinates, and nasal septum. Then we're going to palpate maxillary and frontal sinuses. So, I'm going to check the patency. Okay. Will you tilt your head back just a little bit? I don't like sticking this. Okay. Great. Her nasal passages seem patent. I have a deviated septum, and when you look up my nose, it looks red, but hers doesn't look that way, so that's great. I'm going to palpate and make sure her sinuses are okay. Sometimes your sinuses can drain down. I know when I have a sinus infection, I have pain everywhere on the top of my face. Okay. Okay, for the oral cavity, Leah doesn't have braces or anything like that, so she doesn't have any foreign objects in there on a normal basis. Can you open your mouth for me? Okay, stick your tongue out. Open a little bit more. I'm going to use my light. Okay. Great. Okay. Okay. Can you stick your tongue out into the left and right, up and down? Great. Her teeth, gums, oral mucosa, and tongue look normal. Her Salivary glands are moist. She doesn't have swollen tonsils, yes. So she's good to go. Okay, cardiovascular, I need you to remove a foot for me. I mean, a shoe. Remove a shoe for me. We're going to palpate her pulses, check capillary refill, and auscultate.
1 or 2?
Just 2, please.
Just 2. Like you've got more
Okay, and
than
if you'll
that.
sit back on the bed and prop your feet up for me. Thank you, ma'am. Okay. I'm going to check all of her pulses. Sometimes, if you have edema, it is harder to feel these pulses, but Leah does not have edema. Okay, let me have your hand, please. Oops. If we were going to do a blood gas on her, it would be important to do the test on her to make sure that her blood is flowing equally so that we don't cause like necrosis or something like that. Great. Okay. Now, I am going to, I need to check her capillary refill. Let me have a finger, please. Okay. And her toes, I'm sure her capillary refill is fine because her pulses are fine. She has, I think we document less than 3, and hers is definitely less than 3. It's very normal. Okay, we learned to do this ape to man, to listen to your heart, so that's what I'm going to do. Everything sounds good. Okay, I think we're good. Now, for her lungs, her respiratory rate seems normal. If I were taking her blood pressure, I would count it without telling the patient because that sometimes makes them nervous. But I'm going to listen to her and count it during that, and hopefully she won't pay too much attention to me. Okay. Okay, just breathe normal. Okay, now posteriorly, we like to start at the very top, have the patient breathe normal breaths. In our book, it gives a specific diagram, and they're very small, but we just move down the back. I seem to hear the best wheezes towards the middle of the patient's ribs and crackles towards the bottom for some reason. But Leah has neither. Okay, sit up straight for me, and I'm just going to feel her chest expansion posteriorly and anteriorly. Everything feels and looks normal. Okay, Leah is only 20, so she doesn't have to get mammograms yet, but to do a self-breast exam, we've been taught to do it 7 days from the beginning of your period. For patients that aren't having a menstrual cycle, we teach them to pick a day every month that they'll remember and do it every single month at that time. It's best if done in the shower so you don't have clothing in your way. So you would just start palpitating and go clockwise around your breast, and if you have any things that seem swollen or enlarged or odd, you would need to report that immediately and see your doctor. Okay, for the abdomen, we're going to inspect, auscultate, percuss. We're going to demonstrate light and deep palpation and check for rebound tenderness as well as CVA tenderness. So lay back for me, please. Okay. Leah is normal. She doesn't have any known abnormalities on her belly. I'm going to auscultate vowel sounds in all quadrants. When I first started nursing school, this was extremely hard for me because I never heard anything. I didn't know that was really bad. Leah's probably hungry, just a little growling. Okay. Now, we're going to do percussing and light and deep palpation, which is the percussing and the light palpation is kind of the same thing, but do you have any pain?
No, ma'am.
Okay. Now, for light palpation, we just like to use 3 to 4 fingers and palpate the abdomen in all 4 quadrants and around the umbilicus. And for deep palpation, we use 2 hands and go deeper. We like to measure the edge of the liver. Make sure nothing's enlarged or abnormal. Okay, now for rebound tenderness, this would be for a fluid wave. We would see if the patient had any edema, which she doesn't. Can you sit up for me, please? And for CTA tenderness, this is great to check for kidney stones. If the patient is having CVA tenderness, they do have, or most likely would have a stone and have severe pain. So, no pain?
No pain.
Great. Okay. Now, musculoskeletal. Let's see. Will you stick your hands out for me and adduct them, so bring them in, abduct, stick them out. Pronation and supination, can you turn your hands in and out for me? Thank you. Okay. Now, will you stand up, please, and we're going to check for scoliosis. And will you move your vest for me? Thank you, ma'am. Whoops. Okay. Now, you just have the patient bend over to touch your toes and monitor as they come up. All right, you can stand up. That there doesn't seem to be any obvious curvatures of their spine. While Leah's up, I'm going to have her walk heel to toe for me, and I'm just going to observe her gait and posture and stature that way, and also balance. Okay, that's good. Thank you. Okay. If you'll sit on the bed, we'll check your legs as well. Will you? It's kind of hard to adduct your legs, but will you stick your leg out and in? And then pronate and supinate, so twist them in and out, please. Great. And then we'll check her dorsal flexion, so can you stick your feet up and down, or plantar flexion, and in and out, please. Great, thank you. Okay. I need to check her grip, so I'm going to have her grab my hands. All right, now can you push down on my hands? All right, now push up on my hands. Okay, now push in on my hands. All right, and push out on my hands. Let's see. Push out on my hands. There we go. Okay. Now we're going to do her deep tendon reflexes. And just so I don't miss any of these, I like to make sure I'm on the right track. Well, I can't, but it's okay. Okay, for this, we're going to use our little fella here. Stick your arm out for me, please. And we're going to check the bicep reflex. Okay, I can feel her twitching. It's not huge, but she's good. Now I'm going to check your tricep. There we go, a little one. Okay, the quadricep. And we also did her patellar, and she has the knee jerk. It's just small. Now we're going to check her Achilles. There we go, a little foot twitch. Okay, for monofilament, we are going to do the cotton. The pen, I'm sorry. We don't have a pen for monofilament, so I'm going to use just, it's a dull sensation. Okay, will you close your eyes and tell me when you feel pricks? Okay. Great. All right, let's do this one. Okay, now tell me, you don't have to take your shoe off again, but just tell me when you feel something. Yes. Yeah. Great. She's not a diabetic and has no neuropathy, so she's good. Okay, now we're going to just check her senses with this makeshift cotton swab indicator. So close your eyes for me and let me know when you feel something. Okay, thank you, good. Okay, and now I can't really say this word. Patient's not supposed to see this. For stereo. Okay, I'm so sorry. The previous video timed out, so we're gonna pick up where we left off. For stereognosis, we are supposed to place an object in the patient's hand that's known, like a key or a safety pin or a penny, and ask them what this object is. So I'm going to place this object in Leah's hand, and she's going to tell me what it is.
It is 2 keys.
Great. Fantastic. Okay. We observed Leah's gait when we checked her for scoliosis. I'm going to observe her, stand up for me. The Romberg test, you have the patient close their eyes and you stand close to them to make sure they don't lose their balance, and you check their balance this way, which is great. Okay. And then we did the heel to toe walking. And could you touch your finger to your nose for me, please? Great, thank you. Okay, and lastly, we're gonna check the patient's smelling sensitivity, which is the first nerve, the olfactory senses. So, you tell me when you smell this and what it is. Alcohol. Great. Okay. We also have to do the smelling chart. So I'm going to have the patient come right here is where we figured out. Okay, can you close your left eye for me, or cover your left eye, and read down the chart as far as you can read. B, F, P, T, O, Z, L, P, E, D, P, E, T, F, D, E, D, F, C, Z, P, P, E, L, O, P, D, D. Yeah, no, that's good. Okay. Can you cover your right eye and do your left? E, F, P, T, O, Z, L, P, D, D, P, E, C, P, D. Okay, that eye is a little bit weaker. She missed 2 letters. Not terrible. She would still pass her driving test, but her left eye is definitely weaker than her right eye. We have a small smelling chart for our close range, and we want to hold this about 14 inches away from the eye and do this without contacts, glasses, or anything like that. So we're going to hold about right here, and you cover whichever eye first that you prefer, left or right, and read this for us. 958742843 638 8745 63925. Okay, other eye please. 958742843 638 8745 63925 428 365 37425 937 Great. So her right eye is definitely stronger than the left. Okay. So, in conclusion, her smell, these are her cranial nerves. We checked her smell, her vision, which is nerve 2, her optic nerve. reaction to light, direct and indirect, and perla. Ocular motor, or cranial nerves 3, 4, and 5, and 6 are her range of motions, and everything was good. Can you bite and clench down like you're chewing? I've eaten with Leah. She can chew. She's great. Her motor and sensation for her facial nerve is great. Hearing is good. Glossopharyngeal, vagus. She has a gag reflex. We didn't elicit it, but she gags and swallows correctly. Can you turn or shrug your shoulders for me? Yes, and then just turn your head against my hand, against my hand, against my hand. Great. And we checked her hypoglossal, her tongue, so she is good to go. That is all. Thank you, Leah.